MLT case studies, case study topic, deciphering ABO blood grouping, a slide method exploration, understanding blood group determination through a practical case study. So introduction, this case study explores the significance of ABO blood grouping system, a crucial test in transfusion medicine, pre-surgical procedures, and understanding genetic inheritance. Through the slide method, we delve into the practical aspects of blood typing, highlighting its importance in medical technology and patient care. Objectives: the learners will understand the principles of ABO grouping. They will learn about the slide method technique. They will interpret the results and implications of ABO grouping, and they will appreciate the importance of accurate blood typing in patient management and transfusion medicine. Patient background and demographics. The subject is a patient required a blood transfusion due to scheduled major surgery. Given the critical nature of the blood compatibility, precise ABO group typing is imperative. The demographics of patient include she is a 45-year-old woman with a hysterectomy due to large uterine fibroids. No prior history of transfusions or known adverse reactions has been observed. Initial presentation include the symptoms of anemia, including fatigue, pallor, shortness of breath, which were attributed to heavy menstrual bleeding caused by uterine fibroids. Relevant medical history: the patient has a history of uterine fibroids diagnosed 2 years ago with conservative management until symptoms worsen, leading to the decision for surgical intervention. Clinical presentation revealed a markedly enlarged uterus on palpation consistent with large fibroids. No additional abnormalities have noted. So the diagnostic approach include tests ordered, CBC and ABO grouping has been done by slide method. The initial findings include CBC indicated a mild anemia and ABO grouping initiated to determine the patient's blood type for possible transfusion. So the results of CBC looks here. So the WBC is under normal, that looks 4.8. The normal is 4 to 10,000 cells per cubic millimeter of blood, and RBC is 4.2, and normal range is 4.2 to 5.4. That indicates the RBC is slightly on the mild anemic status. HB also 11.5 instead of 12, indicating a mild anemia, and hematocrit values are 35.5 instead of 36 to 46, indicating a mild anemia in this patient. And MCV, MCH, MCHC, RDW looks the normal this value looks normal, right? So diagnostic approach of ABO grouping, we have performed with a slide method, that is a rapid method, where we have taken antisera A, B and D, and we added 3 drops of blood, and we proceeded for mixing them with a separate mixing sticks, and we got an agglutination. The agglutination has been observed in antisera A and D, indicating this is a positive blood group. So differential diagnosis, the differential diagnosis include why the patient is in anemic status. Maybe the anemia induced due to ongoing uterine fibroids condition, so that might be triggered her anemic status. So the final diagnosis has been A positive with anemia secondary to uterine fibroids. This was confirmed to the slide method for ABO typing and subsequent CBC results. So treatment and management. The treatment plan included a secondary hysterectomy with pre-arranged matched blood for transfusion, and the outcome: the patient underwent a successful surgery with transfusions as needed, resulting in resolution of anemia and elevation of the symptoms. Key learning points: the slide method for ABO grouping is a simple, rapid and essential technique in clinical laboratory. Accurate blood typing is critical for safe blood transfusion and avoiding hemolytic reactions. Understanding blood group genetics can aid in diagnosing certain conditions and in forensic medicine. Relevance to the practice. This case emphasizes the role of medical lab technicians in performing vital diagnostic tests such as ABO blood typing. It showcases the importance of these tests in patient management, transfusion medicine, and broader healthcare system, reinforcing the need for precision, accuracy, and understanding in MLT work. Thank you very much.